This feature is brought to you by JPH MP Direct, the companion site of the Journal of Public Health Management and Practice. Today, Dr. Daniel Bornstein talks about a new article published in the Journal of Public Health Management and Practice, which looks at whether certain states may pose a greater risk to military readiness and national security.
Southern U.S. states have a larger percentage of adults that do not engage in leisure physical activity. Additionally, southern states tend to have a higher prevalence of self-reported obesity.
Thanks so much for joining us today, Dr. Bornstein. How does the prevalence of noncommunicable disease, morbidity, and mortality, coupled with high physical inactivity and obesity in the South, affect U.S. military readiness?
So there's very direct and potentially indirect relationships. So obviously we know that there's a cost associated with the treatment of largely preventable diseases like diabetes, heart disease, and things like that. So nationally we're spending a great deal of money to treat those diseases, and in the South, where the prevalence of those diseases are even higher, we're disproportionately spending a higher percentage of our GDP to treat largely preventable diseases. And currently, roughly 17.9% of our GDP, gross domestic product, is spent on the treatment of disease, whereas roughly 3.5% of our gross domestic product is spent on the military. So if we could actually spend less on treating disease by preventing it, naturally that would free up some money for other areas. Military spending could be one of them, education could be another one. So that's sort of the indirect relationship. The more direct relationship is that we've seen that among military recruits, those who are less physically fit are significantly more likely to become injured. And it's those injuries that they sustain during basic training that have become a significant cost to the U.S. Department of Defense. So it's directly impacting military spending. So because recruits are coming in with lower levels of fitness than ever before and sustaining injuries at a higher rate than ever before, and recruits coming from the South are significantly less physically fit and more likely to become injured, these states, again, are disproportionately burdensome for the costs associated with treating the injuries that they're receiving while they're in basic training.
What are some of the factors contributing to the disproportionate public health burden in the South? And then why are policies designed to improve physical activity and fitness inconsistently implemented across the country?
So I think, in the South, we definitely see higher rates, as we had mentioned earlier, of non-communicable disease. And we know that many of those diseases, diabetes, heart disease, and certain cancers, are strongly associated with physical inactivity. And if you were to look at a map, a CDC map, of the prevalence of physical inactivity among the adult population in the United States, you would see that southern states do have higher rates of physical inactivity. And we also, when we look at obesity maps, we also see that many southern states have higher rates of obesity, which also is associated with many of these non-communicable diseases. Why is that the case? Largely because of the policies and systems and environments that exist within those states. We know that physical activity is a health behavior and proper nutrition is also a health behavior. And we know that while health behavior can be impacted by and is impacted by having knowledge, skills, and attitudes, which are very much at the individual level, wanting to and becoming and staying more physically active is much more closely associated with the environments in which people live than it is their knowledge, skills, and attitudes. So if we have environments that support active living, support healthy nutrition, then it's much easier to intervene on individual level behavior, and we can expect that behavior is going to change. But then in the absence of appropriate policies and systems and environments that support good health behavior, it's not likely that we're going to see those changes happen.
So what role do state lawmakers play in helping to increase population levels of physical activity and fitness?
Right. So we talked about policy, systems, and environmental change. So if we just strip out policy, we talk about big P and little p policies. So little p policies could be policies that are implemented maybe within a place of employment or within a school or within a community, whereas big P policies are typically laws. And so state level legislators have a significant role to play. Education policy is largely determined at the state level. And obviously state level lawmakers can incentivize or de-incentivize corporations within their states to do certain things. So state level lawmakers have a very important role to play in improving the physical activity and physical fitness levels of individuals within their states. And much as we've seen with tobacco control and even seatbelt usage, a lot of the greatest public health successes that we've had have come as the result of state level policy change. So it's important that state level lawmakers be engaged in the policy discussion about how we can create the environments and systems that will allow more of the residents of their state to become and stay more physically active and therefore become more physically fit.
How might reframing this issue of physical inactivity and low fitness as matters of military readiness and national security advance advocacy efforts aimed at increasing population levels of physical activity and fitness?
So we have spent roughly 25 years talking about the impact of physical inactivity on disease, or the relationship between physical inactivity and disease, and the relationship between physical activity and health. And as of yet, we've not realized sufficient buy-in from lawmakers to create the policies and systems and environmental change that we know would improve population levels of physical activity and physical fitness. So the question is, what is of interest to lawmakers? And for some lawmakers at the state and federal level, health is important and prevention is important. But the reality is, unfortunately, for the vast majority of lawmakers at the state and federal level, prevention of disease and public health are not necessarily prioritized. However, national security and military readiness have been cornerstones of American government ever since its inception. So if we can speak the language of the lawmaker, the policymaker, whether that's national security or something else, we should be speaking in ways and talking about how the things that we can do in public health will positively impact the things that are most meaningful to them. And given how meaningful national security is to lawmakers, if we can demonstrate, as we have in this particular article, how physical activity and low physical fitness impact national security, we're much more likely, I think, to get buy-in from lawmakers to develop and then implement the policies that we know would, again, increase population levels of physical activity and physical fitness.
This feature has been brought to you by JPH MP Direct, the companion site of the Journal of Public Health Management and Practice. To learn more about the research presented in this talk, visit us online at journals.lww.com/JPHMP.